right. Hi, Mrs. O'Sullivan.
Hi.
My name is Dr. McKinless.
Hi.
I know you've been referred to us, so I'm going to be taking a look over your portfolio and your case here. I'm going to ask you a couple of questions. Just respond as honestly as you can. There's no right or wrong answer.
Okay.
While you answer, I'm going to be writing these down. Don't let that distract you. If you have any questions for me, please let me know, okay?
Okay.
All right, so my understanding is you're here because you've been having issues with tinnitus lately.
Mm-hmm.
So I want to ask you real quick, what's your profession?
Well, I work in admissions. I do enrollment, advising, combination of all of it. It's all over the phone.
All over the phone. Okay, do you experience this problem often while you're on the phone? Is it at work that you experience this issue?
It is sometimes. I don't get it as much at work. I get it a lot at the end of the night when I leave work.
At the end of the night when you leave work, like on your drive home? Maybe.
Yeah.
Okay. Okay. Now, did you first notice this issue when you started your job at admissions, or when did you begin to notice the ringing?
I've had the issue for years. It's gotten a lot worse lately. So I first noticed it probably when I was in college or even high school. It's been so long I can't remember. And then it's just the past probably 3 or 4 months, it's been really bad.
Okay. Do you currently suffer any hearing loss in either of your ears?
No, not hearing loss.
Other than the ringing, do you hear any other sounds?
It's just really high pitched ringing. Sometimes I do feel like I have pressure, if that makes any sense.
Okay.
In there. And I've had issues with this ear being sore before, with nobody could figure out what that was about. I haven't had that in a while though, because I stopped wearing my headset. I think that's what was causing that.
Was it the inside of your ear or the outside?
It was the outside.
Outside
for that.
Do either of your ears ever feel full or stuffy?
Yeah.
Can you tell me a little more? Which ear?
So that's the kind of like the pressure that I meant. Is kind of feels full, kind of stuffy.
You said that was your right ear?
No, it's usually both ears when that happens.
Okay.
Yeah. I don't notice it more like at any time of the day or anything. It doesn't happen when I get the ringing. It's like a separate issue, I feel like.
Is it pretty constant, or?
I don't get it. It comes and goes.
It comes and goes. Is there anything you've noticed that you can do or that you have done that brings it on, or is it random?
I feel like it's random, but I have noticed it quite a bit when I'm driving.
Okay.
So, I don't know if that has anything to do with it.
Does it hurt at all?
No.
Does sound, hearing any particular sound hurt your ears?
When I hear the ringing, it
the
bothers me.
Tinnitus ringing, not like a phone ringing. You're not hearing an actual thing. Okay.
Yeah. When I have that, it bothers me when I have other noises coming in. I wouldn't say it hurts. It's just a lot to deal with. It stresses me out.
Okay. Feels overwhelming, but it's not a physical pain.
Yeah.
Okay. Do you have any pain when hearing? Does it strain you to hear anything in particular? No? Okay. Do you have a history of ear infections?
No, I've never had an actual ear infection that I know of. That pain that I was telling you about, I went and saw an ear, nose, and throat doctor. They gave me steroids for it, which helped a little bit. It seemed to help at the time for a couple weeks, but then the pain came back. I haven't had it in a while. I don't know what finally made it stop coming so frequently, but that's as close to an ear infection as I think I've had.
You mentioned you haven't had that pain since you haven't worn your headset on that
Mm-hmm.
ear. Is that so? Do you think the pain in your ear was caused by wearing the headset?
I think so. It also was still doing it after I stopped wearing the headset for a while. But I noticed that I'd find myself like sleeping on that ear, so I even changed the side that I sleep on. And I think the combination of that helped.
You said for a little while. If you could just estimate for me, how long after not wearing that headset did you continue to experience that pain?
Probably a year.
About a year? Okay. Thank you. Have you had surgery on either of your ears before? No? Do you find yourself experienced quite a lot of noise at any time? Do you go to a lot of concerts in your free time? Do you ever at any point feel over encumbered by sound or noise?
Not recently. I used to listen to music really loud and go to concerts and things like that. Not so much anymore. Um, Sometimes when I'm talking to people on the phone, it gets really loud. It's a little too unbearable, so I have to kind of pull the phone away from my head a little bit and turn the volume as low as it'll go when I'm talking to people. But that's about it.
You ever find yourself feeling dizzy or off balance?
Yes.
Yeah. Can you tell me more about those times? When do you feel dizzy or off balance?
So it happens a lot when I'm driving, but I started seeing a neurologist a couple years ago, and he attributed it to my migraines.
Okay.
Which he diagnosed me with migraines and attributed it to that. I don't know for sure if that's what it was, but I still get it from time to time without a migraine. So,
how often do you feel dizzy or off balance?
sometimes I get it really frequently, where it'll happen like a couple weeks in a row. I'll get it almost every day, but then I go for periods of months where I don't have it, and then all of a sudden I'll have it again, and so it's hard to kind of track how often.
How often would you say, rather, if you had to guess, is there a time between these sort of spells you get where, for a week or so you'll get dizzy? Is there a common time interval, maybe once every 6 months you'll get these spells, or anything like that? No, it's very intermittent, very random.
Like it's been a while since I had them as frequently as like every day for a couple weeks. I think the last time it happened was probably 2 or 3 months ago, so it hasn't happened a lot lately.
Okay. When they do happen, how long do they last?
It depends. It's usually not too long. Like one of the times I noticed it while I was driving, I had to pull over and sit for probably 10 minutes, and then I could drive again.
Mm-hmm.
But I was still, feeling the after effects, feeling dizzy still. But it's usually less than 15 or 30 minutes, I'd say, somewhere in that time frame.
Anyone in your family suffer any hearing loss?
My grandfather, I know he wears a hearing aid.
And do you know what's brought on his hearing loss?
Probably old age.
Right.
He's almost 80. I think he is 80, actually. He just turned 80.
Do you know how long he's suffered this hearing loss?
For a while. I remember riding in the car while he was driving, like 5 years ago, and it was pretty bad. He had his blinker on in the car. He didn't realize it was on because he couldn't hear it, and like he'll leave the engine of the car running because he can't hear it, and it's a push start. So.
Okay. Are you currently suffering any medical conditions?
I have celiac disease, and I'm pregnant.
So you are suffering.
I wouldn't call that one suffering.
Are you currently taking any medications?
Just prenatal vitamins.
All right. I think that about covers everything. Thank you so much.
All right, thank you.